Philippines extends coronavirus lockdown until April 30. Philippine Cabinet Secretary Carlo Nograles announced that Philippine President Rodrigo Duterte has approved a recommendation to extend the lockdown to April 30. The enhanced community quarantine will be extended from April 12 to 11:59 p.m. to further prevent the spread of the novel coronavirus. According to CNN, Nograles made the announcement during a virtual media briefing. The enhanced community quarantine currently covers the island of Luzon, which is home to 57 million people. Nograles said that there is no need for the lockdown to extend to Mindanao or Visayas. On the evening of April 6, Duterte addressed the country to say that he was inclined to extend the lockdown until April 30. He also said that he would like to change the country's 2020 budget to account for those affected by the virus response. 200 billion pesos of the 4.1 trillion peso 2020 budget has been allocated for cash grants to poor families during the enhanced community quarantine. Unfortunately, it may not be enough. Duterte advises economic officials to find a way to set aside a bigger budget for the poor during the enhanced community quarantine because the economy is not moving, it's at a standstill. Luzon accounts for 70% of the Philippines' output, which means that the lockdown's restrictions to movement would likely severely hurt businesses. A significant number of businesses and factories have had to close due to the enhanced community quarantine, forcing many to budget what they have in order to survive the lockdown. The Philippine Department of Health has recorded 3,660 confirmed cases of coronavirus, 163 deaths due to the virus, and 73 recoveries. The Interagency Task Force on the Management of Emerging Infectious Diseases in the Philippines had previously said that the government would take into account 5 factors before extending the lockdown. First, they would look at the trends in the COVID-19 epidemiological curve, including its doubling time, deceleration, and acceleration of new cases. Second, they would analyze the capacity of the healthcare system, including its facilities for quarantine, isolation, and treatment. This would also include the system's capabilities for contact tracing and testing, and the availability of medical gear. The 3 other factors they would consider are the country's social, economic, and security factors.